Welcome back to the channel. Today, we have reached the final video in our comprehensive postpartum recovery series. We are going to address a physical reality that almost every single new mother faces, yet it is so frequently dismissed as just another standard, unavoidable complaint of motherhood. We are talking about the profound, sometimes completely debilitating back and joint pain that follows pregnancy, labor, and the relentless physical demands of caring for a newborn. When you bring a baby home, the entire world immediately focuses on the infant's absolute comfort. But meanwhile, you are walking around in a body that feels entirely foreign to you, carrying an agonizing ache in your lower spine, a burning tension across your shoulders, and joints that feel like they belong to someone decades older. If you are waking up feeling completely stiff, if bending over the crib brings tears to your eyes, or if your wrists are in excruciating pain just from picking up your baby, you are not simply complaining. You are dealing with severe musculoskeletal trauma and massive biomechanical strain. Today, we are going to break down exactly why your skeletal system feels so fragile right now, the everyday newborn care habits that are secretly making the pain worse, and the specific, actionable steps you can take to finally find some relief and rebuild your strength. To truly understand the origin of this pain, we have to rewind the clock and look at what your skeletal system has endured over the last 9 to 10 months. Your body did not just quietly grow a baby, it fundamentally altered its entire architectural structure to accommodate that baby. Throughout your pregnancy, your endocrine system pumped out massive quantities of a hormone called relaxin. As we have discussed in previous videos, relaxin's primary biological job is to loosen your ligaments, which are the tough bands of tissue that firmly connect your bones together. It specifically targets the pelvis, allowing it to widen and open for childbirth. But relaxin does not just stay localized in the pelvis, it travels throughout your entire bloodstream, systematically loosening every single joint in your body. Your knees, your ankles, your hips, and your spine all become hypermobile and structurally unstable. Combine this extreme joint laxity with a rapidly growing belly that aggressively shifts your center of gravity drastically forward. To keep from falling flat on your face, your lower spine had to hyperextend, creating a deep, exaggerated curve in your lower back known as lumbar lordosis. For months, the muscles in your lower back have been locked in a constant, exhausting state of tension, desperately trying to stabilize a wobbly skeleton while carrying 20 to 40 extra pounds. Then you go into labor. Childbirth is an absolute athletic marathon. Whether you labored for 5 hours or 48 hours, your muscles were pushed to their absolute physiological limit. If you had a vaginal delivery, you likely spent hours holding your body in awkward, highly strained positions. You might have been pulling your legs back, curling your spine tightly, and exerting a staggering amount of intra-abdominal pressure to push the baby out. This intense exertion alone can cause severe muscle strains, micro tears in the muscle fibers of your back, and deep bruising around your tailbone. If you received an epidural, your pain was managed, but you completely lost the protective sensory feedback that tells your brain when a position is causing tissue damage. You might have been lying slightly twisted in the hospital bed for hours, or your legs might have been positioned awkwardly by the medical staff, leading to severe, lingering joint pain once the medication finally wore off. Furthermore, the actual injection site of the epidural in your lumbar spine can remain deeply bruised and tender for weeks or even months, creating a localized hotspot of aching pain right in the center of your lower back. If you had a cesarean section, your abdominal muscles, which are the primary anterior support system for your spine, were surgically incised. When your core is compromised by major abdominal surgery, your lower back has to take on all of the physical labor of keeping you upright, resulting in massive, agonizing muscle spasms. But the physical trauma of pregnancy and birth is only the beginning. The real culprit behind chronic postpartum musculoskeletal pain is the absolute ergonomic nightmare of caring for a newborn baby. Let us talk about what I call the feeding hunch. Whether you are breastfeeding or bottle feeding, you are likely spending upwards of 8 to 12 hours every single day sitting down holding a baby. The natural instinct of every single mother is to bring her body down to the baby. You round your shoulders heavily forward, you drop your chin entirely down to your chest so you can gaze lovingly at your newborn, and you curve your upper spine into a tight letter C. This sustained, unnatural posture places an unbelievable amount of strain on the cervical spine in your neck and the thoracic spine in your upper back. The muscles between your shoulder blades become overstretched, weak, and constantly burning, while the muscles in your chest become incredibly tight and contracted. You are essentially creating a postural imbalance that locks your upper body into a permanent, painful hunch. And the physical strain goes far beyond your spine. Have you recently noticed a sharp shooting pain at the base of your thumb, right where it meets your wrist? A pain so severe that it feels like the joint is catching or grinding every time you try to lift your baby out of the crib or snap a tiny onesie? This is an incredibly common postpartum condition known as Decker-Vein's tenosynovitis, affectionately but tragically referred to as mommy thumb. It is caused by the relentless, repetitive motion of scooping your baby up by placing your hands under their armpits, which forces your wrists into an extreme, awkward downward angle while bearing the entire weight of the baby. The tendons in your thumb and wrist become severely inflamed, swollen, and agonizingly painful. Your hips and knees are also taking a massive beating. You are constantly bending over to change diapers on a table that is likely too low for your height. You are carrying heavy, incredibly awkward infant car seats that force your entire body to tilt entirely to one side, completely throwing off your pelvic alignment. You instinctively pop one hip out to rest the baby on it while you try to cook dinner or answer your phone with your free hand, creating a severe structural imbalance that radiates pain straight down your leg and up into your lower back. You cannot simply tough out this kind of pain, and you absolutely should not accept it as a permanent condition of motherhood. You must actively intervene to protect your joints and rehabilitate your spine. The very first line of defense is a radical overhaul of your daily ergonomics. Let us fix the feeding posture right now. You must bring the baby to your breast or the bottle, never your body to the baby. When you sit down to feed, sit all the way back in a supportive chair with firm lumbar support. Bring a massive stack of pillows or a very firm, dedicated nursing pillow and place it on your lap. Elevate the baby so high that they are completely level with your chest while you sit perfectly straight. Relax your shoulders completely down away from your ears. If you feel yourself hunching over, correct it immediately. When you are lifting your baby out of the crib, do not keep your legs straight and bend at the waist like a hinge. That places 100% of the baby's weight directly onto the most vulnerable, fragile discs in your lower back. Instead, widen your stance, bend your knees, pull the baby incredibly close to your chest, and use the powerful muscles of your legs and your glutes to stand back up. When you are carrying the baby, actively and consciously alternate sides. Do not always carry them on your left hip. Switch to the right hip. Better yet, utilize a highly structured, ergonomic baby carrier that distributes the baby's weight evenly across your upper back and both shoulders, taking the localized strain off your wrists and your lower back entirely. For the wrist pain, stop scooping the baby up from under their armpits with your thumbs extended. Instead, slide your forearms completely under the baby's body to lift them, keeping your wrists perfectly straight and completely neutralizing the strain on those inflamed tendons. Rest is important, but absolute bed rest will actually make joint pain and stiffness significantly worse. Your joints and muscles need gentle, restorative movement to heal, to flush out inflammation, and to regain their normal range of motion. Begin with incredibly gentle, slow stretches specifically targeting the chest, the neck, and the hip flexors. Do not attempt high-intensity workouts, heavy weightlifting, or high-impact running until your joints have fully restabilized and the relaxin has completely left your system, which can take up to 6 full months after you stop breastfeeding entirely. If your pain is severe, persistent, or heavily interfering with your ability to care for your child, the absolute best investment you can make is an appointment with a specialized physical therapist. A physical therapist will not just tell you to stretch, they will assess your unique postural imbalances, check for conditions like diastasis recti, which is the separation of your abdominal muscles, and give you a highly targeted, safe exercise protocol to rebuild the deep foundational core, strength that is required to truly support your spine. While generalized aching and stiffness are incredibly common, there are highly specific red flags that require immediate medical attention. If your back pain is accompanied by a sudden loss of bowel or bladder control, or a total numbness in your groin or saddle area, this is a sign of a severe neurological emergency called cauda equina syndrome, and you must go to the emergency room immediately. If you have sharp, electrifying pain shooting rapidly down the back of your leg, past your knee and into your foot, accompanied by severe numbness or weakness in your leg, you may have a herniated disc severely compressing a nerve, which requires professional medical imaging and specialized treatment. Do not ignore severe localized pain that does not improve with rest, or pain that is accompanied by a high fever. Motherhood is a profoundly physical job. It is demanding, it is exhausting, and it requires your body to perform like an elite athlete day in and day out on virtually no sleep. But you cannot sustain that level of output if your structural foundation is crumbling. You have to start treating your own physical recovery with the exact same level of devotion, care, and hypervigilance that you give to your newborn baby. Do not feel guilty for asking your partner to take over the heavy lifting. Do not feel selfish for taking 20 minutes a day to stretch your spine in total silence on the floor. Reclaiming your physical strength is not a luxury, it is an absolute necessity for your long-term health. This brings us to the end of our comprehensive postpartum complications series. We have covered the dark, difficult, and painful realities that so many mothers face entirely in the shadows. My greatest hope is that this series has armed you with the medical knowledge, the confidence, and the fierce self-advocacy you need to protect your health and your healing. You are performing an absolute miracle every single day. Be incredibly gentle with your body, honor the massive physical and emotional transition you are moving through, and remember that your well-being is the most important foundation your family has. Thank you so much for watching. Take a deep breath, and I will see you in the next video.